Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, this week's question comes in from Facebook, and the question is, how soon after birth can I have a Vaser Lipo on my neck chin? And the details on this is the lady is 36 and 31 weeks pregnant and looking to have the lipo on her double chin as soon as she can after she's had her last child, and at her age, is elasticity an issue? So, Dr. Pane, what suggestions do you have in this case?
Well, I have a few suggestions. Based on the age, I get a sense that the skin probably is good, although it's not possible for me to say that completely without seeing some photos. Normally, after a delivery, people usually say to have a cosmetic procedure, you want to wait 3 to 4 weeks just to make sure you're fully recovered. If there was a C-section or something involved, it may be a little bit longer, but usually about 4 to 6 weeks is the longest you need to wait. Now, if you're talking about doing liposuction or a tummy tuck or anything where the pregnancy has changed, it's going to be affected on the way the body is after recovering from the pregnancy, and the neck could be one of those areas. So it may be something to wait perhaps more like 6 to 12 weeks, depending on how enthusiastic you are for the procedure, just to make sure you've given your body enough time to return to its pre-pregnancy state, or as close to that pre-pregnancy state as it's going to get to see. If the skin is of good quality in the neck area, liposuction will work pretty well for that. The Vaser is a type of ultrasound liposuction that works well. It has a little more potential issues than standard liposuction or some of the laser liposuction. The reality is most of those technologies aren't so important. It's the removal of the fat and the compression that you do afterwards by having a proper neck support garment there that you use that will be the main driver of the results. So I would say minimum 4 weeks, possibly longer, depending on how your body changes after the pregnancy. And if you're talking about a lot of skin laxity of the neck, then it's possible that you may need something else. But at 36, you're probably young enough where lipo alone will work.
Well, thank you, Dr. Pane. If you have a question for the doctor, please visit our Facebook page or website. And Dr. Pane, we appreciate your time, and we'll see you on the next question.